Welcome to the world of emergency medicine. I'm Dr. Michael Zappa, and with me is Dr. Christina Drummond. In the next few minutes, we're going to tell you about the newest and most exciting specialty, emergency medicine. Come join us.
In 1979, the American Board of Medical Specialties formally recognized emergency medicine. Since that time, it has become one of the most competitive residencies. Although there are now more than 80 emergency medicine residency programs throughout the nation, there is still a tremendous demand for these highly trained emergency medicine specialists. This should come of no surprise when one considers that there are over 87 million patients cared for each year by emergency physicians.
Emergency medicine is clearly the broadest specialty, demanding knowledge of medicine, surgery, obstetrics, trauma, pediatrics, and almost any specialty area you can think of.
A large proportion of the patients that we see have general medical complaints. Physical examination skills are very important, but this is only one of the many areas in which the emergency physician is expert. Interpretation of all types of radiographs is a skill that the emergency physician uses daily. One moment, the emergency physician is diagnosing a simple pharyngitis, and the next moment, his clinical skills are challenged by an acute myocardial infarction. The years of caring for the severely ill and injured make the emergency physician expert at resuscitation. At the time when most physicians' offices are closed, the emergency physician may be the busiest. Pediatrics is an area in which the emergency medicine specialist becomes very familiar. Taking care of children can be very rewarding. On the other hand, the interaction can be life-saving when the diagnosis of meningitis is made. Technical skills are important to the emergency physician. They include suturing, central line placement, splint applications, intubations, chest tube placement, diagnostic peritoneal lavage, and many, many others.
The emergency physician's expertise at diagnosis and stabilization is called upon in handling the immediate and potentially life-threatening injuries caused by trauma. In the trauma center, we treat victims of high-speed automobile accidents. Burns and explosions are commonly handled by the emergency physician. Knowledge of hyperbaric medicine not only can save divers, but victims of smoke inhalation as well. Penetrating trauma, such as shootings or stabbings, always test the emergency physician's skills maximally. Many simple tasks provide great reward, such as foreign body removal from the eye, or the birth of a healthy newborn.
If we've managed to spark your interest in emergency medicine, you're probably curious as to the specifics of training.
Some emergency medicine residency programs accept residents straight out of medical school, while others require the completion of an internship first. These programs vary in length from 3 to 4 years, as well as in environment, that is, community versus university hospital settings. As with any specialty training in medicine, one must carefully research the opportunities to decide which program suits him or her best. Upon completion of residency training in emergency medicine, one must pass both written and oral examinations to become board certified.
Speaking of opportunities, there are plenty. Currently, there are only about 9,000 board-certified emergency physicians in the country, with about 25,000 jobs available. One of the more attractive aspects of emergency medicine is the flexible scheduling. The majority of emergency physicians work 12-hour shifts, and although this can be very stressful and busy, it affords the physician time to relax, enjoy his family, and pursue other interests, both in and outside of medicine. Although the majority of emergency physicians enter practice upon completion of their residency, there are fellowships available in areas such as toxicology. The highly trained emergency physician is comfortable working in a high-volume Level 1 trauma center, as well as the less hectic suburban community hospital.
One of the unique aspects of emergency medicine is the setting up of practice itself. A physician may be employed by a hospital directly, work for a large corporation responsible for staffing emergency departments, or be a partner in a small physician group responsible for providing emergency department coverage. The advantages and disadvantages of each must be weighed by the individual. In addition to directly caring for patients, emergency physicians have the opportunity to be involved in teaching, cutting-edge research in areas such as resuscitation, run emergency medical systems, and become involved in hospital administration. The excitement and challenge of emergency medicine is never ending. The sense of satisfaction from being able to handle any illness, any time of the day or night, without ever turning anyone away is tremendous. This has been a look into the world of emergency medicine, an exciting specialty
And a great career.